As one of my friends told me, he was diagnosed with type 2 diabetes 16 years ago when he was only 25. Now he takes insulin as well as pills. This is the first time he has been motivated to live and eat healthy. I advise you not to wait for this diagnosis and check the early signs of diabetes right now. Make sure you see this video until the end. Some signs may be non-obvious. Did you know that over 37 million people in the United States have diabetes, and 1 in 5 of them don't even know it? Recognizing early signs is the critical first step in preventing long-term complications like kidney failure, heart disease, and nerve damage. Don't forget to hit the like button to save this video for future reference. These signs are essential, and you'll want to revisit this information. Let's dive into the topic. The first sign is frequent nighttime urination, nocturia. If you find yourself waking up multiple times during the night to urinate, this could be an early sign of diabetes. This condition occurs due to osmotic diuresis, where high blood sugar levels overwhelm the kidney's capacity to reabsorb glucose. When glucose spills into the urine, it pulls water along with it, causing increased urination. The renal threshold for glucose is around 180 milligrams per deciliter. When blood sugar levels exceed this, glucose is excreted in the urine, leading to dehydration and further thirst. A study published in Diabetes Care highlights nocturia as one of the earliest and most persistent symptoms in people with undiagnosed diabetes. What should you do? Stay hydrated, but monitor your blood sugar levels closely. Work with your doctor to manage blood glucose, as proper control can alleviate nocturia within weeks. Speaking of dehydration, another symptom often linked to this issue is excessive thirst, which can become a constant companion for those with uncontrolled blood sugar. Excessive thirst often accompanies frequent urination. The dehydration caused by fluid loss triggers your brain's thirst mechanism. Additionally, people with high blood sugar levels may retain sodium, exacerbating the thirst cycle. The connection between polydipsia and diabetes lies in the body's feedback loop. As osmotic diuresis depletes fluids and electrolytes, your body craves water to compensate. According to a study in the Journal of Clinical Endocrinology and Metabolism, addressing electrolyte imbalances, particularly potassium and magnesium, can significantly reduce this symptom. What should you do? Include magnesium and potassium-rich foods like avocados, spinach, and bananas in your diet to restore balance. While thirst and urination are more obvious signs, diabetes can also quietly damage your nerves, leading to another concerning symptom, peripheral neuropathy. Tingling, burning, or numbness in your feet or hands is a classic sign of peripheral neuropathy, often worse at night. Chronic hyperglycemia damages the tiny blood vessels that supply nerves, leading to oxidative stress and glycation. Peripheral neuropathy affects up to 50% of people with diabetes, per the National Institute of Diabetes and Digestive and Kidney Diseases. Research emphasizes the role of alpha-lipoic acid and vitamin B1, benfotiamine, in reducing nerve pain and restoring some nerve function. What should you do? Consider supplements like alpha-lipoic acid and benfotiamine after consulting a healthcare provider. Pair these with consistent blood sugar management to prevent further damage. Nerve-related issues don't stop there. If you experience an uncontrollable urge to move your legs at night, restless leg syndrome could be pointing toward another diabetes-related complication. Restless legs, especially at night, may stem from deficiencies in vitamin B1, thiamine, and magnesium, often depleted in people with high blood sugar levels. Without enough B1, lactic acid builds up in your muscles, causing discomfort. The Journal of Neurology links RLS to magnesium and thiamine deficiencies, both of which are common in individuals with insulin resistance. Correcting these deficiencies can provide rapid relief. What should you do? Supplement with magnesium glycinate, which not only calms restless legs but also promotes better sleep. Reduce your intake of refined carbohydrates to prevent B1 depletion. While restless legs can keep you tossing and turning, another issue that might disturb your nights is unexpected sweating, an often overlooked symptom tied to blood sugar imbalances. Unexplained sweating, particularly on the face, neck, or upper body, can indicate blood sugar imbalances. High or low blood sugar levels activate the sympathetic nervous system, putting your body in fight or flight mode. Research from the American Journal of Medicine identifies autonomic neuropathy, a common complication of diabetes, as a primary cause of abnormal sweating in diabetics. What should you do? Keep a glucose meter by your bedside to check for hypoglycemia if night sweats occur frequently. Adjust your evening meals to include balanced proteins and healthy fats for better glucose stability overnight. As night sweats make your sleep restless, high blood sugar can also disrupt your body's ability to produce melatonin, leading to delayed sleep onset or vivid dreams. The Journal of Sleep Research highlights that high glucose delays melatonin release from the pineal gland, directly impairing sleep quality. Hypoglycemia-induced nightmares result from cortisol spikes as your body struggles to stabilize blood sugar. What should you do? Follow a low-carb diet and avoid eating close to bedtime. Incorporate foods like fatty fish, rich in omega-3s, which naturally boost melatonin. Beyond sleep disruptions, diabetes also leaves its mark on your skin. A common early indicator of high insulin levels is a condition called Acanthosis nigricans. Darkened, velvety patches of skin, usually in the neck, armpits, or groin, are often an early sign of insulin resistance. This condition, called Acanthosis nigricans, develops when high insulin levels stimulate skin cell growth. A 2023 review in Diabetes Therapy underscores Acanthosis nigricans as a strong predictor of type 2 diabetes, particularly in older adults and those with a family history of the condition. What should you do? These skin changes warrant a checkup. Focus on reducing insulin resistance through diet, exercise, and weight management. The effects of diabetes go deeper than the skin. Even during sleep, it can disrupt your cardiovascular system, leading to a condition called non-dipping blood pressure. Healthy individuals experience a drop in blood pressure during sleep. In diabetics, this dipping effect often fails, leading to nocturnal hypertension, a significant risk factor for cardiovascular complications. The Journal of Hypertension reports that non-dipping patterns are common in diabetics due to autonomic dysfunction. Addressing blood sugar levels can restore this natural rhythm. What should you do? Limit sodium intake and prioritize potassium-rich foods. Regular aerobic exercise also helps regulate blood pressure and improves insulin sensitivity. Finally, if you often wake up with a pounding headache, it could be another overlooked clue of diabetes at play. Morning headaches are often a result of dehydration caused by nocturia or electrolyte imbalances. Elevated glucose levels can also lead to mild brain swelling, triggering discomfort. Studies in the Journal of Diabetes and its Complications show a strong link between dehydration, nocturnal blood sugar imbalances, and early morning headaches. What should you do? Hydrate with water enriched with electrolytes, particularly magnesium and potassium, to prevent overnight dehydration. Understanding the early signs of diabetes can save you from severe complications down the road. By recognizing and addressing these symptoms promptly, you take the first step toward a healthier, more vibrant life. If this video was helpful, please hit like, share it with loved ones, and subscribe for more life-changing health tips. Together, we can make health awareness a priority.